Welcome back to Sickle Cell Awareness YouTube channel. Today I'm going to talk to you about the sickle cell immune system. I began to take gabapentin, which is a medicine for restless leg syndrome. I had a bad allergic reaction to gabapentin because I began to develop lumps and swellings internally. I began to develop bumps and red spots all over my body. I began to scratch uncontrollably. So before I reported it to my primary care physician, I was doing research on foods that are healing healthy properties for the body, especially for sickle cell patients, to build the immune system, to manage the hemoglobin, and to also to make sure the iron levels are where they need to be. So I began to do research and I began to order foods, go to local markets and purchase these foods, and I began to take them. And as I began to eat certain foods that my body wasn't used to, I began to notice the breakouts began to grow worse. The internal lumps got worse. And I noticed that my breathing changed. I began to have trouble breathing. So I went to my primary care physician and he referred me to an allergy specialist. I went to Dr. Joe, and as we were sitting there in the consultation, I began to tell him all of the things that were going on with me and the medications that were going on with me. And he knew about sickle cell beta thalassemia. So, which was great because some physicians don't know about sickle cell beta thalassemia. So, his first comment was most patients that have bad asthma, allergies, and sinuses are having those problems due to a low immune system. So he ran tests on me for my immune system to see what the levels were. And the levels were pretty low. So he asked me what asthma medicine was I on. And I told him I was on Pro Air. He said, okay, and I noticed that you have chronic bronchitis. So he said, what medication are you on for chronic bronchitis? And I was telling him that I've been diagnosed with chronic bronchitis, but I was never given any medicine for it. So he placed me on a medicine called Spiriva. I am on 18 milligrams of Spiriva. It is the best thing. Ever since I've been on Spiriva, I've had a better quality of life, health-wise. So I take a capsule and I place it on the inside of this handy handheld inhaler, and I do this once a day. And since we're rebuilding my immune system, we set the goal of 5 years. Dr. Joe set the goal of 5 years, but we're gonna rebuild it within 5 years. So I'm excited about that. The first exam that he did on me, my immune system was at 68%. And since I've been taking Spiriva, we're at 77%. When I went back for a follow-up exam in August, it was 77%. So I was excited about that. And he also informed me that I'm not going to see him every month. I'll see him every 3 months, 3 to 4 months for a full examination. But I will be coming to the office every Monday to have an allergy shot. So I'll be doing an allergy shot every Monday until my immune system is at 100%. I'm excited that we do have health goals, and I'm excited that this will not be a long-term thing, 5 years or less. I'm excited about that. And I'm also excited about that he believes and understands holistic health. He also understands that you don't have to be on medicine for the rest of your life. Your lifestyle will determine and your therapy will determine how long you be on anything. I remember when I was diagnosed with osteopenia, and we set the goal of 6 weeks where I would not have to have bone replacement and hip surgery because the physical therapy is going to put me in a place where I don't have to go through all of that, which is preventive care. I'm always talking to people about the importance of preventive care. Current care and preventive care is what makes or breaks a lot of things. The earlier that you're detected with something, the earlier it can be treated, and it can also avoid other things coming in the future. So I always recommend and talk to people about the importance of knowing your body and knowing your health, knowing that when changes take place in your body, and also observe the medication that you're taking. Also observe the medicines, their reaction to your body, because everybody's body is different. So anytime you have any questions or concerns about what's going on, you make sure you talk to your primary care physician and get what you need in order for you to live a healthy and full life. And this concludes me talking about the immune system. Until next time, stay well. Don't forget to subscribe to my channel and follow me on Facebook, Instagram, and Twitter.